All right, now we are here from the Department of Children and Family Services. We have our new secretary at the table, new interim secretary.
Good afternoon.
How you doing? You introduce yourself just for the record.
Absolutely. Yes, ma'am. Senator Bear, my name is Terry Ricks. I'm the Deputy Secretary, Acting Secretary for the Department of Children and Family Services.
All right. So, Madam Interim Secretary, let me just first kind of start off with saying we welcome you. We know you. You've been serving in the Deputy Assistant Secretary role for some time. And after the resignation of the Secretary, you were next in line
Yes,
to receive the mantle. As many of you may see, I do have the photos of the two babies here, which I am going to maintain and keeping because they both lived in my district. To my right, Mitchell Robinson III, and to my left, Jahari Paul, and I may be mispronouncing his first name, because that's going to serve as a reminder for me in terms of my commitment to this issue. I know that there are not many things that you can say to these particular cases because of the litigation, but I wanted to serve as a constant reminder. And if it gives anyone, if it upsets anyone to see their pictures, then that's going to be on their behalf, because for me, it's not. Those babies did not ask to be in the situation that they were in. And prior to this hearing, we didn't even know about little Paul, because we was planning on having this hearing just to have a follow-up. And then before we can even get the information to the department, we've learned about him. We owe the children, because they are the only group that truly don't have any voice and no one to speak for them. So we have to speak for them. So while I know that you have a lot on your plate, I know that you're going in trying to look at what can be done differently. There are just a couple of questions that I will have as it relates to the process. And I couldn't find my notebook from our last hearing when we talked about the different layers. So we know we have the tiers in terms of cases, and when a tier 1, tier 2 comes in, those are emergencies. They receive immediate or within 24-hour assistance. But I want to talk a little bit about the layer of employees, and I want to talk a little bit about Baton Rouge in terms of our system, because this bothers me greatly because they are both in Baton Rouge. That's number one. When Baton Rouge was supposed to be having additional wraparound services. So I want to make sure in terms of our wraparound services in the Baton Rouge area, what does that look like? And if anything has happened to fill any gaps, because we have we have the caseworker, then the supervisor.
Yes, ma'am.
Then the manager, then there's a regional.
And then
What's the regional's name? Regional coordinator? What is it called? Regional director?
the next would be an area director who's
Area
over the
director.
region of Baton Rouge. Yes, ma'am.
Okay. And the regional area director is responsible for just Baton Rouge or several areas?
The Baton Rouge region.
Just the Baton Rouge region. Okay, so.
And then the regional administrator is actually over 3 regions.
Okay.
Administering 3 regions.
So, as much as you can give me, tell me how that process worked to try to make sure that there are no gaps.
Yes, ma'am.
Okay.
May I first thank you for the beautiful pictures of the children that we lost too soon. I also want to speak the name of Ezekiel as well. Ezekiel Harry from Homa, Mitchell Robinson from Baton Rouge, and Jari Paul from Baton Rouge. These children represent all the children in Louisiana that we are concerned for. We're concerned to look at what happened with them and to look at all the children that are in Louisiana so that we can figure out how, as a system, a complete system, which includes DCFS, but is of course much larger than DCFS, so that we can figure out how to address what brings the children to our caseload or bring them to our attention at all. To answer your question, I want to say to you, Senator Barrow, that it's been a learning curve for me this week. Many things I learned this week were things I really had seen already, and yet had the opportunity to double down on that learning. That is to say, things like those persons who show up to work here every day are committed souls, and they have taken this oath seriously. To answer the question relative to what is the current structure in Baton Rouge, I would like to add to it a statement that we are looking at the structures to ensure that they are what they should be given our current scenario and the needs that we have. I shared with you, I think earlier this week, and love to share with the committee at this time, that we had some more recent conversations with Casey Family Programs. We had day-long meetings on Wednesday that were set already before these committees came. We've actually been preparing for it for about 9 months. But with that, we took a look. It was a very timely meeting for me to meet with entire leadership staff of child welfare from across the state. All those who work in the state office, all those who work as area directors throughout the state, and those that work as regional administrators. They were in the room when we met with Casey, which also gave me an opportunity to see them and speak with them face to face, to address and hear from them about what they see as concerns and barriers, the things that are pain points for them. And we had some very productive conversations with Casey in the room where they were leading us to understand where are our pain points and where can they bring their expertise to assist us in moving forward. In that conversation, there was a specific group that was set up to talk, and I happened to be in this particular group for this exercise, where we were talking about the structure of the agency, how we hire, who we hire, how we retain, and what efforts we currently have going on to addressing the pain points that we've identified, and whether or not it's enough, or some of even the 7 strategies that we have identified, have we made sure to remove something that we should not be working on while we start working on something new? That being said, what has happened in Baton Rouge is we talked about sort of the line of supervision for a caseworker. And you had that right. A caseworker reports to a supervisor, who reports to a manager, who reports to the area director. But there are other support roles in the office. And what we have installed in Baton Rouge to assist us with some of the things that have come up has taken some good time arm wrestling with civil service, and they have been super supportive. But we have added, for example, someone to assist the area director with the administrative responsibilities of the office. When we liken back to a time where I was the undersecretary of this department under Governor Blanco, where we did have, of course, more personnel spots, we were using them in various ways that we have not been in the last 15 years or so, based on the fact that we've had less TO spots available to us. So adding back in someone to assist the area director with the many administrative responsibilities so that the AD, as we call them, can actually be more focused on the practice of child welfare as opposed to how many people have taken all of the training required by civil service or by the Office of Risk Management, or have we finalized all of the paperwork to switch someone who was hired into a job appointment into a permanent TO position. Those things are super important, but they do take away from the focus of child welfare practice. That was new. The other thing that has recently been added to Baton Rouge is a case assigner position. We did not have that in our recent structure, so that there is one person responsible for receiving the cases from our centralized intake, which is a centralized unit that receives the calls and receives those reports that are made by what we call the portal, an online manner.
When was the case assigner added?
Within the last few weeks.
Prior to or after?
So we had someone beginning to flesh out that role, but we just hired the person who will keep that role Monday. I believe they started Monday.
Okay.
Case assigner.
Okay.
So that's two examples of what we do when adding what we've added in Baton Rouge that is not yet in other places across the state. Maybe one or two of them is in Baton Rouge, but trying to pull in what we've learned and what we've learned from these unfortunate events. And we've also, of course, had what we call the rapid response team that has come in from around the state. So we started with a crisis team, and we still have people that have basically moved to Baton Rouge to work on the crisis team to fill in some of the vacancies while we're hiring, and those persons are being trained. In addition to the crisis team, when the majority of them went back, we then also used what we called a rapid response team. And the difference really is that we did a call out and 90 persons from child welfare and other areas came in, but they only came in for a week. And they were given some lower risk cases as well as closing some cases that have not yet been closed. And there's many reasons why cases haven't yet been closed, and we can talk about that if you like. And currently we have 5 sets of 2 in the latest round of rapid response to be able to continue the support of the work in Baton Rouge, in addition to the nurses that we pulled in to assist with those substance exposed newborns, which we have talked to you about before, that continues to increase.
Before you go any further, I want to stop right there for a minute. Yes. I know Senator Jackson has a few questions, but let me tell you what my concern is. And this is not something that you could perhaps necessarily answer. But part of my concern is when we had our hearing, so we had our hearing, our first hearing, and then Health and Welfare has had 2 hearings. And at the last hearing, there were specific questions that was asked about the Mitchell case at that point. And we went through what was supposed to have been in place. What bothers me is if we had those things in place in Baton Rouge and it's still seemingly we missed it to some degree. And I understand the scenario. You and I went through the differences of the case. The cases are not the same, but both children did die from fentanyl. But I'm looking at where the ball fell in the Baton Rouge region. That's because that is what bothers me. It bothers me that I feel like there were extra safeguards or extra measures put in place to ensure that we didn't have a child to fall through the crack, but yet we did with a lot of additional services that no one else in the state necessarily has.
So thank you, and it's a perfect question, and it is what we're the X that we're solving for, and we didn't have the case assigner at the time. However, what I do want to say is that the other thing that happened coming from this hearing soon after Mitchell's death, we met here, we talked about, we put a lot of things in case, including a change in policy, right? And so I had to have the staff write this up for me so that I might say it right. And
Okay.
sometimes that glasses work and sometimes they don't. I think I just have dry eyes. The last time we appeared in the committee, we presented a policy change involving children aged 0 to 3. Subsequent to that, there was an increase of 26% of new cases from August to September. While many of the cases rose to a level where investigation was warranted, many didn't. We're in the process of evaluating the policy change now and working with mandated reporters to help them better understand which cases they are required to report under this policy. Now, to answer your question, the other thing that changed is more cases came in. And so we are dealing with the same 24 hours that everybody has. And with all the people that are in, there were more, even more cases that were triggered. And so when the process of reassigning went through a manager, not the case assigner, that's the new part. Mm-hmm. And it was about to happen to move, and our time ran out. The baby's time ran out. That is no excuse. That is the X we're solving for. This is the change that we made. Now, for me, the increase in cases of the 26%, what that says to me.
Is that just in Baton Rouge or across the state?
This one, I believe, was in the Baton Rouge area. But I'll let Mona tell me. This is what I want to say, though. I want you to help me. We all need to figure this out. How in the world are this many newborns being exposed to drugs? This is where I am requesting that we all have some new conversations about the number of kids. It also tells me that how pervasive drugs are, how the whole system needs to be right-sized to tackle the growing problem, how we need to move to figuring out why mothers and fathers are choosing drugs. They need treatment. They need other ways of coping with problems they're facing. They need resources to lessen the problems that they face that push them to drugs. We need opportunities that lead to basic needs being met and communities that thrive. That's what equals fewer drug-exposed babies, whether they come to our attention or not. We need fewer drug-exposed babies, and we need fewer overwhelmed mothers and fathers and caretakers.
I totally agree, and I actually had someone to call me who works at a woman's hospital to share with me what they see.
Yeah.
And hopefully, as we are going through this process, we come up with something to begin to address that starting there when they're in the hospital with the mothers. I know we're fortunate to have the GRACE program, which is helping some of those ladies, but still, there's still so many of them who are falling through the crack, and they are needing help from before they leave the hospital. They are needing that help before they leave the hospital. But going back to this, I want to kind of stay on this a little bit because before I do that, you bring up a good point, and that's something else I'm going to really kind of focus on is the external help that we need, because government cannot fix this issue on its own. We cannot fix this issue on its own. It's a humongous problem that we have, and we're going to need a lot of folks to help wrap their arms around when they see things happening in the community, what they may be able to offer, like faith-based communities. I'm going to call them out in particularly, because if there's just one thing that they can do to help the agency or help someone who stepped up to be an adoptive parent or a foster parent, then all of that can make a difference. But going back to the workers, caseworker, supervisor, manager, area director. Now we're going to ask case assigner, and I'm missing it. What's the other new position?
This is the administrative. We call it, I think, an assistant AD, but
Okay.
basically she does administrative work.
Okay.
Now,
So-
the other parts that we're working on is bringing a multidisciplinary teams together, right? And so the nurses are helping as a part of a multidisciplinary team, right, that goes out and checks on the mother. That's also decreases the defensiveness of the mother, right, of the child, of that family, that you have a nurse coming to check on you as opposed to CPI, right? But then it also brings about the work that we're doing at the Family Justice Center to be co-housed with law enforcement, and both the deputies on the child welfare side spent time on the road this week and last week in these statewide meetings with law enforcement, and deputy assistant have been spending time with hospitals, and to be a part of the solution. If we can tweak a little bit here, a little bit there, it's going to make a bigger difference if we find the right levers that are making the worst difference. And in this particular situation, in solving for X, we believe that not the new caseworkers, and we've been talking about this, we've had over 700 people over the past few weeks show up for jobs at DCFS. So
Yes,
notwithstanding how difficult it has been in the public, there's still these hearts that still want to be a part of the solution. Now, the 55 to 60% of those were coming to work on the other side of the house at family support, and we have a greater number of opportunities there. But that's a lot of people who are wanting to step forward. What happens when you first step forward, though, is that you're gonna have to have a lot of training. And Senator Barry, you gave me information about how potent fentanyl is.
Yeah.
A few weeks ago when we talk about the residue, what could the residue do? That brought up for me making sure that, do we have safety in our employees when they're going into these homes where there might be drugs, so that they're not accidentally touching something that could hurt them. That's something that we need to address. The fear associated with coming on to this job is important for us to address, right? When we as a world, a nation, a state looked around and realized that COVID was impacting everybody, we, reluctantly or not, decided that there was something that everybody needed to do, mandated or not mandated, where we're going to wear gloves, or we're going to put on our masks, or we were going to get. So our eyes have been open. We moved back to some normalcy, and I'm not getting into a public health issue, but I think that we have this other public health issue, and we all have to open up our eyes to figure out how can we help. So we need to fix the infrastructure within DCFS and shore it up so that we have enough people and that the positions are clear. This is another thing that came up, making sure that everybody knows exactly what they're supposed to do. And I think one of the best things that came out of the KC meeting was that those in the field and those in programs were telling us, this is what I see and this is their ideas. And that was incredible, because we do go through that process where we add new things and we don't necessarily realize that we need to take something out. Because prescribing everything is not useful. So, for example, One of the things that we've added is something called CCDM, and I welcome Mona to the table to talk a little bit more about it. But CCDM actually shortcuts some of the regular practice that someone might have, where I'm a worker, I'm going to talk to my supervisor, I'm going to do all this legwork, then I got to get to my supervisor. My supervisor has several case workers to supervise, and right now, unfortunately, that supervisor might also have some cases that they're working. So it might take me a little while to get to my supervisor. So we now have a centralized gaggle of supervisors who are available if a worker has assessed a situation and think, okay, this house is assessed safe, this child is safe. They can call this gaggle of supervisors and find someone to talk it through with them so that there can be a decision made more quickly, and they're not waiting on their supervisor necessarily for that decision. That's an example of something in solving for X. Sometimes it's about reducing the number of cases that are coming in. Sometimes it's about making sure that the resources are available so that the families don't have to come into care, but they can stay in their home and have the amount resources. Sometimes it's about cutting out the number of steps it takes for a worker to be able to do their job. One of the best outcomes I heard from a manager, from a worker's perspective, is that they feel empowered. I have gone in, I have done an assessment, I have the ability to call somebody immediately and close that case so that I can, with a good heart and a good mind, move on to the next one. And it speaks to how prescribed a lot of our processes are, where the workers are, waiting and they can't move until they get to their supervisor, who could be over subscribed at that time.
Before she does, because I'm going back to this, so let me make my question a little bit more clear. So the people that we have here in line for Baton Rouge, the Baton Rouge area alone, so I believe that the case was under a supervisor, which should have then been to a manager and also an area director. So I know the supervisor's gone because she quit.
Yes.
That was part of the process. Are any of those people still there? That's because I believe in this. Everything rises and falls on leadership.
Yes,
so consequently, because at the time the secretary was Secretary Walters, the buck stops with her. But I'm trying to get to, and this is what I want to know. This is the absolute question I want to know for the Baton Rouge area, because Baton Rouge is receiving a lot of help and support. Do we still have the same structure? Not necessarily, because you just told me about one thing that we've added, but do we still have the same people in place?
We have some of the same people that have come in to help.
Okay.
But the AD position is currently open, and we are looking for someone. We think we have a candidate for that. We've already had some interviews, and we think that there may be an opportunity to set 2 ADs in there because of just how big it is. But those are things that we're having some conversations about. The RA position is recently opened up, and we are actually having interviews soon to put a new RA there. Okay. I have looked around, and one of the assessments that we have done is that all the ADs and all the RAs across the state probably could retire already or would be walking out soon. And so that also gives us an opportunity to take those who have that level of experience that can be used in many different places and then get fresh water in the area for people who may be tired, who may need a break, who may need to move to another area, so that they can use their experience while we bring fresh perspective, fresh leadership, and then we also reset the culture in an office. We've got several tools that we're using right now to reset culture, and Mona and the other deputies, and I say Mona, she's sitting right here. We have 4 deputies right now working in child welfare. And the assistant secretary, Dr. Hodnett, who has decided to retire, will stay on as a WAE in 2023, and that's very good because she's got a lot of information that she will be able to and experience to keep as we need her to, and we're grateful for that. But several of all the deputies are working towards making sure that working with Casey and outside of Casey, because we've been working with Casey for a long time, but this is a new approach of working with Casey, that we will be able to identify an actual strategy that is not just immediate and it's not just short term, but it is long term. And so working specifically with Miss Evelyn Jenkins, who couldn't be here today, as the chief deputy, she has been working specifically looking at our plans going forward with so many people being able to retire.
I heard you very loud and clearly. You answered that. You did a very good job in answering that question. And so I hear you. So I know some people have been moved, sounds like, because at the end of the day, if we keep allowing what has been, we will keep getting what we've always gotten.
That's correct.
And so I'm glad to hear that. I'm glad to know that there's been some changes in that arena, so that I would feel a little bit more comfortable in knowing that, because previously that did not work, even with all the safeguards and measures that we had in place. I do believe this with my whole heart. I believe that more than 90% of the people that work in that office are committed to that job. I honestly believe that they don't do it for the pay, because it's not enough money. They do it because they are committed to definitely to the welfare and the well-being of children and families. I believe that. But we still have an element where sometimes people just become burnt out, overworked, or just sometimes just a little bit lethargic because you've been there too long.
Maybe so.
Yes, ma'am. So I'm going to go to Senator Jackson, and we'll allow you, Ms. Michelle, after she asks her questions, to present.
Thank
Jackson.
you. Good morning, Madam Secretary. I want to echo this. Any call made for our immediate past secretary to relieve herself of the position was not a call of, and I want to say that publicly, out of any nefarious or ugliness. It was based on the current events that are happening. Whether when you're in leadership, your hands are on the incident or not, after so many incidents, it becomes apparent that new leadership, is needed. But I do want to thank her for her years of service. I knew her heart for this job and all that she did for this department, and I don't want that to go unnoticed, as she has, resigned this position. I don't think the resignation was a failure of heart or what she was attempting to do, but at some point, some that work under you have a continuous practice, and unfortunately it comes and the buck stops with leadership. But she did give many years of service, and very passionate service, to the children of Louisiana. Just came to a point that some that were working under her, as we're seeing, were not doing their part. It's
Thank you, Senator
unfortunate,
Jackson.
but when we accept leadership roles, we are also responsible for those who work under us. But I don't think that it reflected on her and her heart and her hard work. Sometimes I tend to call it some ugly cancer that hits your organization. And after that, regardless of how strong you stand in leadership, there are those who will not get back in line with the purpose and the goal and what your heart is in leadership. And so I understand and understood her heart, and still do. I think it's a great loss to Louisiana. But however, moving on is necessary when these incidents have occurred. But I did not want that to go unnoticed, her many years of service to this organization. And sometimes people leave because they do something wrong. But sometimes leaders leave because those in the organization continue not to follow leadership. This is a case where she did nothing wrong in and of herself, but there were just those who, I guess, decided, maybe because of burnout or whatever, not to follow the leadership's plan. And I wanted that to not go unacknowledged today. So with that being said, there is still an issue at hand.
Yes, ma'am.
That issue has reoccurred despite how many times this agency has hit the news, despite how many times that news has been of deaths to children. rape to children. I've come down for this interim committee more than I've come down for any other interim committee besides joint budget, which meets monthly, sometimes bi-monthly. And there is a growing concern for this department because you take care of our most vulnerable children who can't speak for themselves. And I still hadn't figured out the breakdown. I thought we left here with a really good plan in our last meeting. And I didn't realize that plan wasn't fully implemented until Monday. Because I think you just testified that someone was hired this Monday to...
Yes, ma'am.
Okay, and what was that position?
The case assigner.
Okay, so tell me about the case assigner. Is that case assigner responsible for every office across the state?
So I'm gonna punt a little bit over here to Mona, who actually is the deputy assistant secretary over the field, all of Louisiana. Mona.
Hey, Mona Michelli, Deputy Assistant Secretary of Child Welfare Programs and Field Operations. So the case assigner role is something originally that started in New Orleans several months ago, probably close to a year ago. And so when we first started looking at this, we had some staff that temporarily came in as part of the strike team. And one of those roles that we filled at that time was of the case assigner. And so what has happened is because of the success of that in Baton Rouge, we are implementing someone on a permanent basis who did start on Monday from a previous role that she had with the agency. It is part of the case assigner is part of a larger model that we're implementing as part of the 7 strategies, which is a child protection model. This case assigner is going to relocate the office to where she will be housed at the Family Justice Center on Government Street, where we will house certain staff as well as we will be co-housed with law enforcement officers. This person, the case assigner, will not just assign cases, but will also have a closer eye given her experience of, wait, this case may be a good case to identify for that may need a CAC. So let me flag this one. This one is maybe a more referral to law enforcement and we need to do a joint investigation. Let's pull that together. So it's more not just making sure the cases are assigned, but also really taking a closer look at those cases.
So would she assign every case that comes in?
In Baton Rouge, yes, except for, so this is a Baton Rouge position. And it is looking at, but it's the East Baton Rouge Parish. Then we are requesting
how
positions.
many TOs do you have open? And I don't mean to interrupt you. How many TOs do you have remaining open right now for this budget year?
Oh, I just pulled that up.
411.
Wait a second. I have a narrative about this. Let me pull it real quick. So right now we're looking at our vacant TO in a more comprehensive manner because some of the 411 are people's B-owned positions, meaning they're working on a project, but that position that's shown as vacant is theirs. It's a property
It's theirs.
right.
I get that.
Right?
They've been transferred to an immediate need. So
if I move out the B-owned, the true vacancies we have are 334. There are 18 in executive and admin offices, 130 in child welfare, and 186 in family support.
So my question is going to be, because I don't purport to know everything about your organization, this case assigner, you may have had some high profile cases in Baton Rouge recently, but we're hearing from DCFS workers all over the state that they are overworked, that they're above the national caseload right now. So the first question I'm going to have is, why can't we have a case assigner in every office?
Actually, that is part of the budget request, is that there is one for every single region, including, another part of that is going to be, and moving forward, another part of that is, you talked about our staff being overworked. One thing that we also want to implement is we have a position called a team specialist. And that is somewhat of a caseworker assistant who does those paraprofessional activities for staff. We are looking to implement one of those in every single unit across the state to support the staff. That's called a teaming specialist.
Okay, let's go back to case assigners. You said that's a part of your budget request, but we have respectfully some positions open. And I understand that you're going to revamp your budget for this upcoming, but I'm saying the current year we're in, what holds you back right now from hiring case assigners for every office?
Actually, nothing.
Okay.
And this is some of the discussions we've been having this week. Now, we might have to use a job appointment to do it as opposed to a TO. And the reason is,
that,
right,
yes.
is that right now, based on the work that we've been doing on the 6 hiring fairs with the 7th that occurred this week, that I may or may not have we have made 252 conditional offers of employment that are working their way through the system, which it takes about 252, 110 child welfare and 142 in family support.
So that's great, because that's taking some of the caseload off of those who are there.
Right.
So
we
on
have
the case assigner, whether we have to use a TO or an
job
appointment.
That's right.
My request is that we don't wait to the next budgetary year.
Mine too.
Right. Thank you.
Thank you.
That we get that done.
We made that this week to make sure that everybody who was in the room on Wednesday understood that you can use a job appointment to get to the structure that you need.
With all deliberate speed.
With all deliberate speed, which includes speed dial for Byron Decato. At civil service, where we have to, because the process, it takes a little while to add a new thing in a new region. And so we are struggling a little bit.
You are here to help
that.
if
Yes,
you're
they are
facing
great.
Okay.
They've been great. And while I have the attention of the room about people being great, let me just say this. The hiring fairs are no small feat. Louisiana Workforce Commission, Secretary Cato has been amazing with bringing things to the table. Civil Service, Office of Technology Services. We've met at community colleges, we've met at hotels, we've met at other state agencies to make this happen. The library in Baton Rouge. And so the commissioner's office has given us 2 HR people to work the hiring fairs, et cetera. And so what might have taken 4 months at some point is taking us 3 to 4 weeks right now. And that's why we call them hiring fairs and not job fairs, because it was a different in intent. It would not have come about were it not for the weekly and sometimes bi-weekly meetings that we're having with civil service, with the commissioner's office, with the chief of staff, with Tina V in the governor's office to help us make sure that we are really bird dogging this. The other side of that, though, is when we then onboard them. DCFS is in the middle of changing out with OTS our laptops, so it takes a little longer to get a laptop assigned and things like that. But there is all hands on deck on both the hiring and the onboarding of the employees to get to where we need to get to. But this work with Casey, I believe, will be some expedient work to help us to see, is there something else that we need to do with the structure? And that's what I mean, if we set this structure up some time ago where there's, when we were downsizing, right? Worker, supervisor, right on up. And then we got rid of admin, and after a while, we rolled out, there's very few persons that are helping with transportation and the admin side. This is the work that they've done, is to identify, we need to add these other pieces back in, but not like we used to, because it's a new set of circumstances. We used to have 15% of the cases that were super complex. Every case that comes in is super complex right now, it seems, especially with the drugs. And so the Casey work along with all of the leaders and is going to help us to determine, is there a new best practice that's out there? Yes, go ahead.
So you're going to take care of that at the each regional office, right? And then who at your level, executive level, is going to manage those case assigners? Who's going to receive their reports? Because that was something we talked about before, having one central person that could work with each regional office to get a report on, how many, and Senator Barrow is very well versed in the language of the 24-hour, what do they call it, when there's a 24-hour case? Tier one
cases.
Tier two. Mm-hmm. So how do we now, who do we have once you hire those case assigners at each regional office? Who's going to receive their daily report on tier one, tier two? Because see, the buck, and we've learned that with the last secretary, is going to stop at the executive level. So I think we really need some communication between those daily communication between us case assigners and someone in your office, whether you have to create that position or not, because we're losing children. And we need to look at that. And I know that everyone sitting behind you and everyone else is overworked. So to put it on someone who's currently there probably would be insufficient, because we call you over here doing sessions several times, right? And your executive team comes with you. So who can and what position can we create to have one person whose job is at the executive level to receive those reports daily, to track them, to look at them, to communicate with the case assigners and make sure they are not, and if they're out sick, that was the issue, I understand, with this last case, to know that there's a case assigner out sick and to figure out where that case report is. Basically, I am suggesting you need someone at the executive level whose sole job is to work with those case assigners, receive daily reports, and be able to report back to you, Madam Secretary.
Thank you. Your concern is noted, and we will be filling the assistant secretary, who will be the person that will have to get
now,
that.
the assistant secretary is over here with you a lot. Session.
Yes, ma'am.
And so
and
I just
that's the
proceed.
deputy. That would be Mona's job to
Right.
make sure that we got that. But listen,
But
when the buck
I
stops,
think that
Yep.
nobody, because I'm going to revisit this.
Yes,
Everyone
ma'am.
that you're naming is called over here several times during session.
yes, ma'am.
And so my suggestion is that we hire someone who solely works with those case assigners. And if they hand a thorough report to you and your secretaries and your undersecretary, your deputy secretary, so you know what's going on. Everyone I'm looking at here, jobs are full. And I think we keep putting Band-Aids where stitches should be.
Thank you.
We keep putting new responsibilities on employees who are extremely already busy. But tracking of cases seems to be a major issue. I don't think it's wasteful to put someone at the executive level that's communicating with those case assigners daily and receiving daily reports and is in the office to monitor those daily reports. What if a case assigner is out sick? Madam Secretary, Undersecretary, Deputy Secretary is over here answering questions.
Senator Jackson received.
Mm-hmm. You see what I'm saying? Okay, good. Because I think the system, we've tried everything. Now we have to double down.
Thank you.
And that's really my request. And I understand that at some point that's going to come to be a budgetary matter and an adding of TOs if you do it by appointment, because we can't just leave these TOs to be those without adding back your TOs to every office because you're overworked. But overworked is not an excuse when we're losing children. So we have to get to a point where we're realistic about how we're restructuring. And that's my only ask. And I know you say, well, we come to the legislature, and I'm going to go back to this because no, seriously, and you guys have not properly funded us at times, and we haven't, and we have some responsibility, and we can't sit here today and act like the responsibility falls just on the department. My understanding is when I first came in the House, and I don't carry those numbers with me, but I know they're absorbent. We did more with less. And you lost how many positions? I mean, it's a joke. We did less with less. It's coming up now. How many positions did you lose when we were doing more with less, supposedly?
As the undersecretary under Blanco, our budget had 5,200 employees. We currently have 3,400 TO.
Has your caseload went up since the Blanco years?
The caseload has gone up. And Eric might be telling me that the TO went up a little bit because we've added some
about to go
new
there, too.
bodies of work that we've added TO.
Trafficking,
with
which was much needed, which we advocated
Absolutely.
for, and that was much needed.
Much
we saw
needed.
what was happening, and so
Extended foster care.
So my concern is this, and I say this every time we call you before us, because the buck's going to stop with you, or whoever becomes permanent, right? We never address it. We never address it. We go in the media, we scream at the department, which is rightfully so. You accepted these positions, right? But we never address the fact that you are now currently at how many employees?
You want to give me the real number, Eric?
TOs wise.
3,600.
3,600. And during the Blanco years, before we start doing more with less,
5,200.
we had 5,200. And now you have a higher caseload, which means you're dealing with more children, but you're under some, I can do the quick math.
So, of course, 500 of those were program areas that moved to other agencies.
Okay, so you're under 1,600. We're going to deduct 500. So you're at 1,100 that still should have been with you. And that was under the Blanco caseload numbers, not under the current caseload numbers. We haven't, that 1,100 is a flat number without adding the new, without adding the percentage of new cases to match the workers needed. And I'm going to keep screaming that because everybody seems that they won't ignore it. Kids are still passing away. Kids are still being raped. Kids are still being put in harm's way. And everyone wants to ignore the fact that you're 1,100 down before you account for any increases in cases since Blanco. But we're putting children first. And that, to me, becomes very hilarious. That no one wants to address the fact that you are 1,100 plus, and I say plus because of the growth of cases down in TOs. That you're 1,100 plus down in budgetary, your budget for staff with growing cases. And I believe in solving it all if we say we put children first. I believe that at some point we make a lot of tough decisions on budgets every day, but tough decisions can amount to kids being harmed and losing their life. And I'm going to keep on addressing that part of it. Now, I am saying the responsibility of what happened here and here was a result of not following through fast enough from what was supposed to be implemented. Now, that is on you. What's on us is the fact that we know you're 1,100 plus down, and we fail to address it every year. Higher education was cut tremendously during that time. And we've been able to adjust that. The MFP was flat funded at that time, and we've been able to advocate for that. Teachers' pay raises were non-existent, and we've been able to advocate and take care of that. I can go on and on. Mental health services was cut severely. It still hasn't been restored, but we've been making gains. We've made gains in every area where we've cut, where Louisiana saw its constituents suffer, but in the area of your TOs. But we're screaming every week, every month we bring you, every 3 or 4 months. But former Madam Secretary continued to talk about that in every committee she went in. And that's no excuse for what's happened. Let me be very, very clear. I love all you guys, but it is seriously no excuse for what happened. Because when you decide to stay, you decide to stay and do the work of 10 horsemen by yourself, if that's the case. Mm-hmm. But we have some responsibility that former Madam Secretary kept talking about, kept pleading for. And people say, well, you know what? Sometimes the governor didn't put it in his budget. Well, the governor sends a lot of budgets over here that we adjust for the greater good of our constituency. And so I don't even want to really hear that as an excuse. The governor has never fully gotten, whether it was Jindal, I guess he did sometimes, or Edwards or Blanco, none of them have ever fully gotten the budget they requested without us tweaking it. That's the legislator's job, to appropriate where we see fit, to tweak budgets where we see fit. My suggestion to my colleagues, myself, and others is that we get serious about those 1,100 positions, even if we can't restore them all, that we begin to restore them. Because, media clips and speeches doesn't do it when kids are hurting. If we're serious about it, we need to be serious about holding you accountable, but we need to be serious about holding ourselves accountable about the TO positions that have been gone while cases increase. If we're talking about a national average, the goal here should be to get below the national average in how many cases your caseworkers work, because for some reason it seems like our situation is more dire. It goes to the point where you talked about, you said it, it is a reality that kids are being exposed to more drugs than ever, while we're having debates every day in this legislature about legalizing drugs. I, for one, have held up on supporting any of that, because we don't have it under control for our children. And I'm not saying that one day I will not support it, but I cannot support things like that when we're seeing kids get a hold of drugs every day. And what's not deadly to me, you, senators, or anyone else that's grown can be deadly to a child. We are facing an epidemic of children in homes getting the hold to things. We had a junior high in my district where a kid brought some Rice Krispie treats, the little colorful Rice Krispie treats, to school. He handed them out to 3 other children, not knowing that they were laced with fentanyl. Is that right, fentanyl? Yeah, that's what we. And all of them collapsed at school. And so I can't continue a conversation about legalizing drugs until we get a handle of what's already been introduced in our homes. And before we legalize anything, we have to get to the point where adults are responsible for what they're handling, because kids can't bear the responsibility of what's happening. Now, those are my thoughts on this. And I want to be real clear about where you share in the responsibility. But I'd be derelict in my duties as an elected official if I didn't recognize that Madam Secretary, the former Madam Secretary, came to this committee, Health and Welfare Budget Committee, everywhere she went, screaming for 7 years about the loss in TOs that were never restored. Now, I really want to see if this legislature is going to be serious this year about children. Because if we're serious about children, we'll recognize the cry of the former secretary who left under dire circumstances. Now, that was her responsibility. She came before the committee and told us what she would do, and it did not happen fully. And so she had to take her own responsibility and resign. Question is, when will the legislature take its responsibility and give you the TOs you need to work with? And people say, well, they have so many TOs that have been unfilled. You have 110 in the process, 142 in the process. During that time of unfilled TOs was COVID. Many were working from home. Children were not in school. Now you have to make up just like schools have made up. I'm very happy to see our SPS scores, school performance scores, going up. We're finally back at pre-COVID, but that didn't happen without funding, without after-school tutorial programs, without a whole lot of federal funding that came down to address what had happened. But kids have been in homes unchecked. And that was no fault of yours on that. COVID just was what it was. But I am advocating for a reasonable restoration of those TOs. And that can only come from you. And I know the governor is your boss, and I'm hoping to see a budget that reflects the restoration reasonably of some of those TOs, if not all, if we can't afford it. My last question is this. Did this state turn down Family First Act money that would have provided for unification? Because that's what's going around, unification of families that would have helped with that and would have helped with things like drug treatment. Tell me about this Families First Act money that we are getting texts and emails that we supposedly turned down. And if we did, the next question is why?
Good afternoon, I guess. At this
Afternoon.
point. Eric Horrent, Undersecretary. We did obtain the Family First Act in, I think, October 2020, 2019. So the way it works is we have transition dollars right now, around 8 million for 5-year period that we can use to implement.
Okay, so, I like a direct answer before we start explaining. Did we accept all the Family
Yes,
First
yes,
Act money that was
yes.
offered to us?
Yes, yes.
Okay,
That's
good.
what I was to say.
Mm-hmm.
That's all the money that was available. We took it, we use it to implement 2 evidence-based projects right now. So the way Family First work, really, it's a federal match.
Okay.
So we're implementing evidence-based project and programs, and we're able to draw down a 50% match. So for the implementation, we had $8 million of 100% federal fund that we took.
So we didn't leave any on the table because we didn't have the state match.
No.
Okay.
We are in our budget request for next year requesting, I think, around $4 million of state general fund. Until now, we have been using this transition fund. That's what was set up to actually establish these programs. Once we run out of that in 24, we're gonna need state general fund. So we haven't reached that point yet. That would
Okay.
be in 2024.
And so what are we doing with the Family First Act money?
So,
You want to talk about it?
yeah, Mona can do it.
We'll tag team this one. So there's 2 evidence-based services through Families First, and the state has submitted their Family First Prevention Act plan, the state plan, to our federal partners. So the 2 services are Intercept, which is an intensive home-based services that are geared towards older youth and preventing those youth from entering foster care. Child First is the second evidence-based program, and that is a program that is designed more geared for younger children that we intend to use for like more of our substance-exposed newborns and those at-risk youth, the younger children. Both of them are in the process of being developed and piloted in different areas. And so Intercept is already in certain areas of the state, and we are expediting the implementation of that program as well in the Baton Rouge area.
So I keep hearing that if a child is exposed to marijuana, it's more likely than not, if they're exposed to marijuana, it's more likely than not that they will remain in the home. Is that correct? By a court, and I know you don't make the final decision.
Right. So, DC by law, if a child tests positive for marijuana that is used in an unlawful manner, that is to be reported by the hospital to DCFS. We do investigate. But remember, just like the everything behind the Family First Prevention Act is to prevent children from entering care when safely able to do so.
Right.
And so that is our goal. If we are able to provide services to prevent a child from entering care when safely able to do so, that is what we want to do.
So my question is that are they more likely to remain in the home when they've been exposed to marijuana? In your professional experience,
more likely than not, yes, that is correct. But I do not have specific data on that.
My answer is why? Because to me, a child exposed to a drug is a child exposed to a drug, and that was my whole conversation about legalizing drugs before we have a handle on the responsibility of adults around children with them. Why is that the case? And why is an exposure of a child to marijuana taken less seriously?
We do not take it less seriously. It is not about the drug, it is about the safety of a child. How does the substance use impact the parenting of that child and that parent's ability to keep that child safe? That's what we have to base whenever we approach a judge, we have to approach a judge with information that the child is at imminent risk of harm or danger. that child without court intervention would be seriously at risk of being abused or neglected. So, that's what's required. That's the standard of proof, and that's what's required in the law.
I just wonder because it seems like, and that's what a lot of medical professionals are telling us, that the cases that are reported with children being exposed to other drugs, you follow those cases, the child is more likely to be taken out the home. But cases reported when children have been exposed to marijuana, they're more likely to remain in the home.
I mean, there are several factors that we have to consider. We have to consider history. We have to consider the type of use, how it affects their daily functioning, substance abuse assessments, mental health. It's a combination of factors. It's not a matter of this drug results in this finding. It has to be, each case is different and requires a different assessment. But it's based on the safety of a child. We frequently tell our staff, it's not about the drug, it's about what the circumstances are around it.
I understand. Thank you, Mr. Chairman. Mrs. Chairman, I have no further questions. I look forward to working with you. Look forward to the implementation of the suggestions made today.
Thank you, ma'am.
Thank you.
Thank you, Senator Jackson. Before I go to Senator Mizell, I would take it, Eric, that you've already have been preparing the budget to submit to the governor.
Absolutely.
Prior to all of this happening. Has anything changed in terms of what the requests were initially as opposed to what they may be now?
No, but they will. Because the budget was due October 31st, which is when we were implementing the changes, what we're going to do is we're going to make amendment to our budget request. We have a lot of things in place that are contract related. I cannot make a request without knowing how much money, which means of financing, and so on. So we talked to the administration about it. We submitted a budget that has position because the need for the position existed before the situation we had here. So that's in the budget. But requests specifically addressing the stabilization of the child welfare program that have been in place in the last couple of months, 3 months, that's going to be put into an amendment to our request.
And so you're in the process of working that out now?
Yes.
Okay, I would like to see those amendments that you guys will be submitting. Okay, Senator Mizell.
Thank you, Madam Chairman. Madam Acting Secretary, I'm going back to you, okay? I would love you to share with us those 7 strategies. You referenced them, and maybe you'd mentioned them earlier when I was in the side room and I didn't hear it, but I'd love to see that. What I have noticed is that, with the concerns going on, primarily centered in Baton Rouge, is that we have other metropolitan areas that I don't see any similar situations taking place. And actually, I spoke to a regional, I don't know the title.
Regional administrator, maybe?
Yeah, she's got the whole area. And I asked her, what do you all do so that at the point where the cases are assigned, so you're going to have someone named a case assigner, and I think, Mona, you and I, we had another meeting before. What I really want to see, and maybe you're going to have a name for it, and maybe it's in this, is who follows up to find out. It's one thing, we can assign cases all day long. But the assurance that I wanted, and that was the whole priority 1, priority 2, 24-hour thing, is that, okay, somebody's within 24 hours saying, so-and-so's out. Who's going to send somebody to that child? And that, I don't care about all the titles or any of that, because this regional person said, she said, oh, I call myself, I call them myself. So is there no set protocol in every region where there's an expectation that these are the steps that are going to happen? And this is, the way we're going to be held accountable. Tell me if that's how it works.
Yes.
Okay.
There there will need to be changes made. And we've actually talked about even practice changes. And this is where I believe the Casey help is going to be so helpful. Because as we look at the number of cases, cases seem to ebb and flow. Like they go up, they go down. We're not experiencing down right now. And so, we're going to have to prepare for the continue up until there's some major changes throughout the community that prevents things like drugs. And so in our recent review of this, and this is where we're relying on Casey to come back with evidence-based practices on the hiring and human resource side. What is the structure should be? Should there be a first contact team who the only thing they do is they go out and make first contact with the babies? I see the children, and then we move it on to the caseworkers to continue it so that we can make sure that we're putting eyes on every child. That's not the current practice. And it's not as easy as it sounds. Let me just say that, because one of the things that we did actually last Wednesday in a 3.5-hour meeting, I think it was Wednesday, was track that down. Then we also have maybe some opportunities in technology that will make that a little bit easier for the caseworkers who are out to get information back to say exactly what happened a little bit sooner. A call I made to Dickie Howes, our CIO at OTS on Friday when everybody was supposed to be off, and he was at lunch and took the call, yielded a team on the ground on Monday to take care of some low-hanging fruit that we believe can be added to our access system to help with that, and Mona is working with that. So you are right. That is my assessment. We're working on that. I want to be able to come back and tell you, let me tell you what we've done to make sure that both what you and Senator Jackson has done seems to be in lockstep. It's like the same concern. It's the same concern I have. It's the same concern that everybody has. But I think there's, we talk about evidence-based practices, and in child welfare, you need them. But there's also some evidence-based practices in human resource structure and development. And I'm getting a PhD in that right now. Like, I'm in a PhD program, and I've been studying leadership and human resource development in the last 18 months to be able to bring to bear some more resources and thinking through our structure, how we set things up, how we help people understand that you're doing a good job, what the research shows in that area too. And that falls into this lockstep. So I think with Casey bringing that to the table with us, and we'll be meeting with them next week again. I believe that we're going to be able to show you something that actually gets to the heart of what happened with these babies, and be able to show you this is what we have done, or this is what we're working with civil service to bring about.
But I want to say, you have people in regions who are already doing it.
They are.
They're doing it. I mean, they found a way to do it. They didn't have to, because, even a layperson looking at it, there's got to be a follow-up. I mean,
and there's some differences, right, in the regions. And that's where we get to when I was talking to Senator Barrow, saying maybe we need 2 ADs in the larger regions where there's so much activity.
Right.
Because the AD is really, and the RAs, they're really kind of held in with a lot of administrative tasks, when we also really need them to making decisions, because usually they're the ones with the most experience on decision-making capacity as well, right? And so some of the newer people coming into the system, they may not have an MSW, they may not be licensed, but they're good and they're learning, but they may not be able to make those decisions. And so you're right on track, and we're learning from them. And so that's what the beauty of having all the ADs and RAs in one room, and for us to think about this all together. And mind you, that doesn't just happen on the Wednesday meeting that we had with Casey. The leadership absolutely learns from what's going on in each region and pulls that up. The crisis is definitely lending itself to less than best practice all across, But what I appreciated from the work that I have done in reviewing is that the leadership in child welfare is paying special attention to all of the other areas, so that if we are borrowing somebody for a short period of time, it is a short period of time, and we're not putting them in the same situation that Baton Rouge has found itself in. However, I will say that I had a conversation with the AD in New Orleans, and this uptick that came in really caused them to lose some people, because the caseload, she said, I was looking at my dashboard. I had 2 caseworkers that were like overly heavy, right? And then we had this change in policy, and it went to 15 caseworkers that were in red, and then 3 of them left because the burden was so high. Casey's gonna work with us to make sure that, are we open the door? Is our assessment still good, right? Do we need to change our assessment at all for those kids that are coming in, the allegations that are coming in? Do we continue to use the tools the same way? Or is there evidence that shows us that even the reporting tools should be different? For example, a lot of the reports, for example, that come in from the portal lack sufficient information. So then you got a worker calling back, trying to find somebody to get more information, for example. And so, Senator Mizell, your questions are right on their mind. I believe this is what we have in our scope. And I believe that the work that we have done will yield finding the tools that are working, not just in one area, but also that are working to change systems in other states and pull them in.
Right. And I have another meeting that started
Okay,
at
I'm
2
sorry.
o'clock.
Yeah.
But I want to thank you for stepping up. I know it was awkward. Nobody wanted it to work out the way it worked out, but we all support DCFS. I want to make sure you all have no doubt. I'm not looking back 7 years. I had no role in that, but we're here. You all do a job that's incredibly important to all of us. We just talked about juvenile justice. We want to have a quality of life for our children from birth all the way through. And I think everybody that is here and everybody in this building is with you to succeed. So please just, no, I just want you to know that before
Absolutely.
I have
Thank
to
you.
leave and go to civic education.
Thank you. Have a good afternoon.
Senator Hewitt.
Thank you, Madam Chairwoman. So it's been a kind of a long afternoon, and there's been a lot of really great discussion. I also want to add my voice and let you know that we are all here because we do believe in DCFS, and we want to do our part in supporting what you do. And the people who work for DCFS, let me give you guys a little bit of a shout out. It takes a special person to work in that role, and the things that you all see every day and the things that you experience are heart-wrenching. And I myself could never do that job. And so to do it day after day after day after day because you care, about children and families is inspiring to me. And so I want you to know that we appreciate what you do. I just can't even imagine how difficult the job it is. And what we have been reading about in the newspaper, has been horrific. It's tragic. And, we can talk about how aggravated we are because the potholes aren't getting fixed, but it's a totally different conversation when children are dying. And, so it is one of the most important challenges, I think, facing our state. And I'm not qualified to tell you how to fix it. You all are in the trenches every single day, and you're working this issue, and we're kind of here on the fringes. We're primarily appropriators, but I would like to ask a couple of questions, kind of in terms of process and how you manage the business of DCFS. And I'm saying you, and I acknowledge that you're new in this role, but you've been serving in an executive, leadership position. tell me, like, what data do you look at every day or every week or every month to assess how well we're doing? You know, there ought to be like metrics that you're looking at every day, every week, every month, where you say, okay, things are going great. Or you may say, warning signs, right? This is not good. We're not on a good track. Something with a warning. Or maybe it's, oh my God, it's an emergency. And so there's leading indicators, you know, of those sorts of things. And the outcomes, of course, are awful, you know. And so it's really important to me, in my way of looking at it, especially with this kind of a business, that you have ways of looking at data on a regular basis to assess that. So you know when to ask for help, you know when to scream emergency, you know when things are going well, and so when they're not, you can get the help. It's not just an annual affair. You can get the help that you need, whether it's from the legislature or, you know, other resources at your disposal. So tell me a little bit about the data and what you look at.
Thank you. Senator Hewitt, one of the things I want from Casey is to make sure that I have the right dashboard going forward as the secretary. I can't speak to exactly what a former secretary looked at on a daily basis, but I know that, you know, she had monthly meetings and we had weekly meetings to make a space for the assistant secretaries to wrangle and say there's a problem. Marquita and I work so well together because we're very different. We would say, you know, the yin and the yang, so to speak. And so I can't speak for what Marquita looked at. I can tell you that I'm going to be looking at a lot of things a little bit differently, and we'll be building some dashboards to make sure that I can personally see what's happening across the board. Mona can talk a little bit more about what she sees at her level, and I think that that's one of the things that I want to make sure to change, is that it's not just the assistant secretary that knows exactly what's going on, but that the data is actually rolling all the way up to me to be able to ascertain that question: how are the children doing? How are the employees doing? And it comes all the way up to the secretary. So we'll be a little bit different maybe than it was when Renda had her numbers and Shavana had her numbers, so to speak, for the assistant secretaries. But I don't have them right now. And so that's one of the things that will be coming maybe in week 2. Week 1 has been super busy, but I don't have a dashboard yet. And it could be just getting the right credentials. But Moni, you want to talk about the data?
Yes. And first off, I want to say thank you. Thank you for your support of our staff. It is a really hard job. And I think the more that our staff can hear that they're valued and appreciated for the hard work they do, it's really appreciated. So thank you. And I do want to start out with some numbers just to understand the context of where we're at right now as well. There has been today, the number of children in foster care, we have 78% more children in foster care than we did on this day 2 years ago. That reflects the amount of staff that we need, and not just positions, but we need people. And that's where we need as much support as we can get, is to bring people to this work. It is a difficult job, and we are struggling with bringing people on and bringing the right people on.
And when you talk about these people, you're talking about foster care parents?
No, we are talking about staff. We are talking about investigators and foster care workers and foster parents as well. We need as many people to join our fight that we can get, because we have a long way to go.
So those would be things you would measure, right? I mean, it might be a good thing that your numbers are going up in foster care. It means that there's less children at risk, maybe, if the foster care situation is better than the family environment that they were removed from.
Right. Yeah.
We do have the data. I want to make sure that we can talk about it, and Mona's going to keep talking about it. It's not that we don't have it and we're not measuring it.
Yeah.
It's just that I don't have access to it yet.
And we do.
Directly,
We have
yeah.
a dashboard that is accessible for all levels within child welfare. And on that dashboard, there's a plethora of data available for foster care, ranging from which foster care cases are open, which foster care children are needing medical exams, dental exams, how long they've been in care, how long, if their placements need updating in the system. The same thing with CPS. There's reports on contacts, whether they have been documented or not documented, what cases are open, what cases are needing to be closed because they're nearing that time frame. We have a plethora of data. Supervisors have access to it. Managers have access to it. We have access to it. We use those tools every day. One thing that we did on a management level in state office is approximately a year ago, we implemented what's called a monthly regional report. And so what we did was, so much data is out there, but we want to know each program area, identify what are the key performance factors that we need to measure, and identify those and have the region report back, at least on a monthly basis, of where are we with that standard, and what's being done to be able to increase it, address it, or how are we doing? Let's recognize the staff for that they are doing a good job. So data, we have an entire data unit. They are our rock stars who really do help us on a daily basis, not only to look at different ways that we can track the data, but how we can evaluate it to be able to determine next steps. So.
And that's good to hear. And of course, I'm not surprised that you do have lots of data. And so I guess I am a big believer in dashboards,
Yeah.
right? Red, yellow, green, and measure things that change behavior, that drive action, so that you can, again, ask for help when you need it, sound the alarms when you need to. And then the data is very helpful. When you come to the legislature, you've got it all there, right, to make your case. What happens if we don't do X, or what can we accomplish if we do Y? And it helps keep, it's a limited amount of dollars, right? And so you're competing for lots of dollars. And what I told Marquetta many times is she's got the biggest heart in the building, right? So she leads with her heart, but not the personalities of those of you that work in DCFS are kind of more heart people than head people, right? You're not the X's and O's people necessarily. You lead with your heart. Chip's smiling. You've been in my office, Chip. We've talked about this many times. So, work on the X's and O's a little bit would be my advice. And I'm not trying to desensitize this at all, because it is a very emotional issue and just a really important thing to all of us. Let me ask you about root cause. Okay, so there needs to be like a root cause analysis when you have tragedies. You asked about how are these children getting drugs? I don't know. But there's a root cause analysis that you can do to sort of kind of drill into that, and so that if you can keep the drugs out of the hands of the mamas and the dads, maybe then the babies don't get the drugs. I don't know, but there's a root cause process, right? And then you find a way to attack that so that you're saving lives. So talk to me about kind of your process on root cause analysis.
I'll start with something in Louisiana that is already existing. It's the Child Death Review Panel through the Louisiana Department of Health. So for children who are under a certain age that die of unexpected reasons, there are local reviews to look at what are the causes, what can we do to look at where can we prevent this, and then there's the state level. As a matter of fact, there is a state level meeting coming up, I believe, on December 6th, and I've already charged our CPS program manager to take this issue to them on December 6th and ask, what can we do as a state to look at preventative efforts with regards to the fentanyl use? So that's one thing that we can do. We also need to look at every day. What can we do differently? I know that Secretary Ricks also talked about just this week that she wanted to do a root cause analysis of what are the issues with child welfare and underlying causes of abuse, and had talked about that, doing that with Casey.
Yep.
So if you wanted to add to that.
Yep. That's it. It's one of the very specific requests we made of Casey just this week, was to assist us with looking at root cause analysis for several of the cases, and be able to put that out from an outsider's perspective, looking in not just internal, even to state agencies, but to run that down so that we can have that data from a third party as well.
Okay. And then when you talk about I think you said a 20-something% increase in cases, so why do we have caseloads increasing, or number of cases increasing? Why does it seem to be happening more in Baton Rouge than in other urban areas? Senator Mizell asked that question. What are some of your preliminary thoughts about that?
Mm-hmm. Yeah, so this is where the root cause analysis is actually going to help us a lot. What is going on in those particular communities when we map where the cases are coming from, what else is happening in that community, and there's some predictive analytics that can also help us to understand, right? What is going on? Are there an increased number of prescriptions in that particular area as opposed to another? Louisiana is very high on the overdose deaths for fentanyl right now. I think number 6 in the nation, maybe. And so it definitely gets outside of us to figure it out. It becomes a public health issue, but that's where our partners are so important, LDH and otherwise. But Casey, I'm hoping, will help us to bring in national perspective and some other professionals to help us dig into that. But we have some tools now in our toolkit, including using the Blanco Policy Center to help us figure out some things like that. But then also the mapping now. It used to take almost like an act of Congress to get all your data mapped in one particular space so that you can go in and take a look at it. One of the other drivers that we have right now to try to get us in prevention and understand what's going on in the community is this My Community Cares, which is a program that we're running where we have data that shows that certain communities are lending an environment or an environment that are sending more kids into our care. And so My Community Care started in, I think, 6 parishes or 5 areas. You want to talk about it?
Yeah, part of it was part of our federal program improvement plan, and so it started in 3 and kind of lended itself to another one, added 4. But now, as part of our redesigned family resource centers that are going into effect or went into effect on October 1st, every region either has or will have a My Community Cares partnership. And so it's more of a grassroots effort to go more upstream in prevention of child abuse and entry into our system. So it really is taking hold across Louisiana and doing well. I do have to say, though, that it isn't limited to Baton Rouge. It's a statewide issue that we're seeing just across the state. I can say, if you look at, we talk about data as compared the month of June to the month of October, there was a difference in 77% of investigations. We did 77% more initiated investigations in October than we did of just 6 months ago. It's impacting our staff. Their caseloads are high, and so that's why we ask for the support. We need your support in recruiting staff as much as you can. So.
Well, it sounds like some of the, you don't call them job fairs, would you call it?
Hiring fairs.
Hiring fairs, have been very successful, and that's encouraging that there are people that want to help. And so that's encouraging. Well, thank y'all for what you do. And again, I don't mean to turn this into a data thing, but I do know that data drives behavior, and And I would encourage you to just sort of figure out what are those handful
Yes.
of most important metrics. I know it's easy to get buried in dozens and dozens and dozens, but what are those things that are the most meaningful, that are really going to drive? And everyone throughout the organization should know what those are, right? So everybody's marching to the same drum, and it gets reviewed often. And I think that'll help unite the department and certainly help build support, with your partner agencies in the legislature when you need it.
Thank you, Senator Hewitt.
All right. Thank y'all. Thank you,
Thank
Madam
you.
Chairwoman.
Thank you, Senator Hewitt. Senator Fessy.
Thank you so much. I want to let y'all know how much I appreciate the two meetings we've had and the data that was brought out to my knowledge and helped me try to help y'all. I believe y'all division is very important to get things going in the right direction. And I know how, y'all big heart in this, and that's what it takes. And so I just want to be help out in different ways. And so I got a couple questions. Senator Hewitt hit on a couple things that I was going to ask, and one of the things is when we line up a case, do we grade the cases? Like, is it an A, a certain level, a B, and to the worst levels?
Yes. So what we do is whenever an investigation, we assign it for investigation, there's a couple things that we look at. Depending on what information is provided, it is assigned a specific allegation. Based on that allegation, it is categorized as a level, which is different than a response priority that you've all heard many, many times about before. And that also helps drive of, wait, if it's this level, I need to get at least this many collaterals and that many collaterals, depending on the severity of the allegation. So some of the allegations include substance exposed newborn. They range medical neglect. We have many allegations regarding sexual abuse, but it includes sexual intercourse, sexual enticement, oral intercourse. So it's a broad variety of allegations to narrow down. It's specifically for the worker what to look for in that specific allegation, and then also what collaterals are needed to be able to support the investigation. The other layer that we have, or the level system that you may be referencing, is the response priority. And when an investigation is assigned based on an assessment, it is assigned a response priority level 1, 2, 3, or 4. And depending on that level is the time frame that is expected for the worker to make initial contact with the victims and at least one caretaker. So for level 1, that's 24 hours. For level 2, that's 48 hours. And then level 3 is 3 days. And then level 4 is 5 days. So those are the two different criteria that we kind of use to look at the direction of a case.
Okay, so that brings me to kind of into my question. The next question is, okay, so when you're grading these levels, what layer of management and y'all teams decides what level or what grade that gets? And what I'm trying to do is get on experiences and how much knowledge each level in y'all position. I think y'all have, 5 layers of management. So I'm just trying to decide, and just get that information to see exactly who's making those decisions on and how much I guess authority they got in saying that whatever the level should be.
Okay, so when a report comes in, an intake worker level receives the information, and they make the recommendation of this is what it's recommended to be. Then a supervisor reviews that information and makes the final decision of whether a report is accepted, what the allegations are going to be included in that report, and then what the response priority is based on the assessment. Once they approve it, it then goes to the local office, and the local office also has the opportunity to review that as well.
And they can make a change in that position
They
if
can-
they think necessary.
They can request a review of that decision if they would like to. Yes.
So where I'm kind of leading that to is back to some of the things Senator Hewitt was talking about, is getting the data. And where I'm going with this is in those different levels. And we've seen this I call it an epidemic of fentanyl throughout the country. So what I'm looking at is the preemptive measures that we can take that data to kind of see what can we do before it gets to the worst level and all that sort of thing. And are we kind of putting that on your dashboard to kind of, maybe we need to watch this case a little more, that we can keep it from going to the higher level. And that's just a thought that I was wondering how y'all handle that.
Actually, we do have something called high-risk criteria, and that's where your manager level comes in, where that additional expertise comes in. So based on set criteria, there are cases that are identified as high risk. And as per policy, that requires a managerial staffing if it meets that criteria. Get some extra level, get some more eyes on that case. We're more concerned. Let's get there and provide some more direction to the staff to be able to try to rectify the situation.
Okay. So, well, like I said, I really, back y'all 100%. I know, we talked in the 2 meetings that we've had with myself that we need more staff and to get more help. But I just want to make sure that we start filling in the holes where they need to be filled in, and making sure that we do the best we can in correcting the problem, which we see the epidemic of fentanyl. So I'm thinking, do we need to think at a different level to start changing that game? Because none of us have that experience.
Exactly.
And so what I'm trying to do is get enough of us together to understand, and maybe, getting other departments involved in our sheriff's departments and all those. Maybe we can grab some data from them on what they're seeing in this fentanyl problem, and maybe combining all that information together and try to do, where I would like to see Louisiana be the number one in the country on getting this problem solved. And so whatever I can do to help, I just wanted y'all to know I'm here.
Thank you, Senator Fessy.
Okay.
Thank you.
Thank you.
Thank you, Senator Fessy. There are no more questions on the board. I do want to make some final comments and kind of end, I guess, our meeting. And Senator Fessy, was Ezekiel Harris from your area?
Yes.
So if you would like to get us a photo of him, we would love
We'll
to
be
add
glad
him as well. I'm going to start off with this statement. The most powerless citizens of our state are our children. They can't vote. They don't have no lobbyists. And all they have are their parents, oftentimes. And if they are unable to step up to the plate, then they have us. I believe that there are many people that needs to come to the table and help you guys along the way, because again, I have always said this, and not just for DCFS, this is in every area, because state government cannot fix all of our problems alone. People talk about the separation of church and state, but the Bible said that the government should be upon his shoulders. So that means that it's not separated if it's on your shoulder. So we'll continue to work with you guys and work with the department, to work with. The First Lady has made a commitment. I think prior to COVID, she has started an initiative, and then COVID hit, and then everything just kind of went aside. And I spoke with her, I believe, yesterday, and she's getting ready to start some of those initiatives back. I told her some of the ideas I had as it related to bringing in the faith-based community, because if everybody just did a little bit, it's going to change the trajectory of all of us. But there are a couple of things that I do want to say in my closing, especially as it relates to the Paul case. I do know that, according to the paper, let me say that, according to the article, there had been at least where the department had been contacted 3 or 4 times prior to the mother who it was stated that she was on marijuana, and I think it's something to the knowledge that she was taking it to help with nausea, something of that magnitude or whatever. But you guys have been called out like 3 times in that case. Going back to what Senator Fessy said, and maybe perhaps Senator Hewitt, that to me should have put them into a certain category when somebody else called. It seemed like to me that it should have. I'm not sure. But I'm going to ask this basic question that we asked in our last committee hearing in health and welfare. Because within 4 months, less than 6 months, we've had 2 babies to die at the age of 2 or under from fentanyl. What safeguard measures are in place today to try to ensure that that doesn't happen again? I know nothing is an absolute, but today, because Baton Rouge had everything supposedly. I mean, when I listened to the presentation a couple weeks ago, it seemed like we had everything you could imagine supposedly in place. What is different today to ensure to the best of your ability that it doesn't happen again?
Yes, ma'am. Thank you. I want to just be clear that everything that we're throwing at Baton Rouge or bringing into Baton Rouge to shore up Baton Rouge is because the deficit is there so deeply. So it's not new wraparound things. It's really like, how can we make these things actually happen? And so we will be assessing to make sure that what we have put in place actually will work. But these 2 things that Mona talked about today, making sure that the AD actually has more time off on her hands and having the actual position with a person in it full time to be the case assigner that's working with the AD for that reason. We believe this is our latest solve for X. That in mind, when my,
Area director, right?
that's the person who's over that particular region,
which
Baton Rouge.
has changed, or that person's no longer there.
So the area director, we have somebody that is working in that area coming from another region right now.
Okay.
But we have someone, we're working on hiring the full-time person there.
Gotcha.
But so we have somebody in the position right now serving in the role. Let me say it that way. We have someone serving in the role right now. And the case assigner is the difference. The case assigner that Senator Jackson has said have one everywhere is because that's where we're hanging our hat. The case assigner that she said, and then who's going to be talking to all the case assigners, right? So this is the latest expression of we must do this differently. But Casey also is going to work with us to take a look at this and make sure, is this enough? Do we need more? Are there other things that we can bring to bear that have shown evidence of solving for X on this issue? So we won't be able to come back to you again and say the case got dropped by somebody. We would know. I've said to the staff, this is what I want to know. This is my piece of data that I want to know every day. Did every child that was supposed to be seen today get seen? And if somehow we ran out of space and time ourselves because of people, one worker got hung up removing children and the rest of the 2 that she had on her caseload today didn't work, then can we at least ask law enforcement to do a well check of that household until we can get to it? They've not said yes to me yet because it sounds real simple and it's not. But this is what we're solving for right now. That's what I want to know. This is what I call Dickie about, right? I want to be able to make it easier for the caseworker who's out in the field to quickly put the information in the phone if need be and say, I saw this child, the child is safe, or I didn't get to my last 2 cases, whatever is the thing that we're going to use. This is what I'm looking at right now. This is what I'm looking for to be different, to be able to say, okay, I want to come back and tell you, this is what we know about every day. We know that every child that had a 24-hour got seen within 24 hours, or they didn't get seen by us. And so we asked law enforcement to go out. And so Mona and Evelyn going out, Renda throughout these last few months, so many conversations with law enforcement, coupling our efforts to understand how much we're both needed. One may have more capacity today than the other one. Let's do it together. Many other conversations with partners, but today, I cannot tell you that tonight I will know that every child got seen. I will tell you that they're using mornings, right? Morning huddles to make sure that everybody got seen yesterday, right? I kind of want to know at the end of that day, not the beginning of the next day. So that I think will help us. We will bring you along the journey with us. The Senate Health and Welfare meeting, I believe, is on December 7th. So we will be having some other updates between now and then as to the other meetings that we have with Casey, as well as what the outcome is with our work with OTS. Madam Chair, I'm 1,000% committed to DCFS. This is my third time working at DCFS, and my very first job, professional job, working at was at DCFS. The people that we serve, the families that are hurting, that are reaching for the drugs, or that are hurting the children in other ways, those who choose to serve as an employee, they're incredible and tired, and we have some ways to re-energize them, and that's what we want to do. We want to show them support. We want to let them see them open up their wings and be able to serve people. One of the things that the staff kept saying is, what will retain employees is having enough services and resources for the clients. So it all ties together because nobody wants to do a job. Everybody wants to have a career that they feel like they can do very well. And so those things really tie together. As long as I'm in this seat, I will lead from our values. And I will be seeking to continue improvements in our safety assessments and our responsiveness. And we'll do that with a bent toward a human-centered design where people will know if you make a call in, what happens next? We'll be able to answer that question. It'll already be answered for them. We're looking to have data-driven services, decisions made by data, and our services by data. I understand the severity and importance of the issues before us. I'm committed to improvement, and I'm committed to supporting the good work that we're doing every day.
Thank you so much for that. I appreciate that. And one of the things that I hear that seems that's going to be substantially different is actually the case. What is it called? Case assignment. Case assigner.
The case assigner.
Case assigner. I do want to go to your sheet here right quick.
Yep.
And when we meet again, or maybe with health and welfare, as it relates to the substance abuse exposed newborns, just in Baton Rouge alone, I see you have 51 cases. So these are children in the hospital. And I want to see what's happening in that arena, because at least here in Baton Rouge, we're supposed to have the GRACE program. I'm not asking you to really be able to really, I guess, be able to answer that. But I'm wondering, when this happened in the hospital, is law enforcement coming in? Do you know? I mean, do you guys know, or are they automatically going to the GRACE program? What's happening there?
I'm going to ask Mona to answer.
No. So, no, law enforcement typically is not involved when the newborn is exposed to substances. There are times when DCFS, because the report is accepted based on the newborn's urine or meconium testing positive, there are many times that the child is released from the hospital before we ever get involved as well. And so there are many programs, such as Grace House, that we try to utilize, but it is all based on, I go back to, an assessment of this family's needs. How are the substances affecting their parenting? What kind of support do they need to stay healthy, to stay safe, and provide for that newborn?
Who does the assessment? Is that from you guys or through the program?
No, DCFS conducts the assessment as part of their investigation. And then we also have a partnership with the Capital Area Human Services District in Baton Rouge, where we have a substance abuse counselor that comes into our office and conducts substance abuse assessments and makes recommendations for treatment. So that's also available in the Baton Rouge area. And then we also refer the newborns to early steps. One of the things that we have recently started doing is we've contracted with nurses. So the nurses are doing an additional assessment of our substance-exposed newborns, which includes like a medical overview of this child and providing resources and providing education to that parent. So that is something that we've added. And actually, I'm supposed to have a meeting at 3 o'clock this afternoon to review that, to say, how is that going? How can we expand that? And then we are also participating in what's called a policy academy with one of our national resource centers. Louisiana was one of the states that was chosen to participate in this policy academy that is just related to the needs of substance-exposed newborns. So what we hope to do is bring what we've already done with the nurses to this policy academy to say, hey, can you help us with this? Is this in line with best practice? What do you recommend? And we're partners on that policy academy with the LDH, Office of Public Health, and there are some other stakeholders that are participating in that. So.
I was going to ask you about the hospitals. Are they participating in that at all?
I don't think there is a specific hospital. They've been part of some other work groups that we've been on this topic, but I don't think they're part of the policy academy.
Okay. Well, I certainly appreciate the work of the Casey Foundation coming in, assisting us with this. And certainly I know that they have a lot of great best practices, I'm sure, and models that we can actually grow from. But this is going to be my commitment, and I'll be looking at this. And so I will be working very closely with you guys, because let me tell you, and you know this already, Mrs. Ricks, Secretary, Madam Secretary, when things hit home, your perspective really change. And there's been so much I've learned in the last week that is too much to digest. We have to make the system simpler, so that when a person does call in, or if they have an issue, they know how to do that. That's oftentimes why people probably don't get involved. We definitely gonna need more partners as we're moving along through the process. But I'm gonna look at criminal penalties for negligence when there is noted negligence. Should there be a criminal penalty? I'm going to look at perhaps, does the department need to be collapsed? Because I'm going to tell you, I absolutely do not believe that the workers who are our case workers who are going out when there's a natural disaster should still be tasked with doing their job while they're trying to handle a disaster. I think that is way too much. And then I'm going to look at, again, how do we work with partners, external partners. That's going to be my commitment. And so I'm being very upfront. No one has to be caught off guard. This is something that's going to be at the premier of my list of things going forward. Because, again, our children, they do not ask to come into the world. They can't choose their parents. They can't choose their families. But when they have failed them, then we are the next in line to ensure that they at least have a good beginning. And as we listen to OJJ, because this always makes me a little sensitive, you know, we talk about the cycle. Mm-hmm. It's all a part of it. Hurting kids become hurting adults that hurt other folks and more people and more kids. It just becomes a cycle. And we have to figure out, we can't do it all, but we have to figure out a way of how we can make a dent in this. And so I appreciate you. Thank you so very much. There are no other comments, no other questions. You do have your hands full, Madam Secretary, and I would hope that as you go forward and as you are giving the instructions to your team, because again, everything rises and falls on leadership. I hope that they adhere to it. And when they don't, I hope that you have the flexibility and the liberty to be able to make the decisions to be able to remedy that. Because in some case, and I'm still not satisfied with where we are in Baton Rouge, not just yet. I have to see more, but at least I hope that you are able to do that.
Yes, ma'am. Thank you.
I'm done.